Yeah, so aspiration. So aspiration and aspiration to liquid are really in many ways flagship studies for TOGA and flagship studies for the delivery of precision medicine at a national scale. So I'll talk about both studies, the aspiration study which is completed and the aspiration to liquid study which I'm very excited to say has just started. So firstly, aspiration. So this is a study co-chaired by Nick Pavlakis and myself, and the study aimed to deliver comprehensive genomic testing to 1,000 patients across the country with newly diagnosed non-small cell lung cancer. And the aim was to deliver this comprehensive genomic profiling in parallel with standard of care testing, and to look at outcomes in terms of identification of targets and commencement of targeted therapies. So what did we find? In the patients that were referred for aspiration, we found targetable oncogenes or potentially targetable oncogenes in over half of patients. Now this slide is actually already out of date, so if you look on the blue, we say no actionable alteration in 50% of patients. But in fact, in the sort of shaded blue at the bottom, these non-G12C variants are now potentially actionable on clinical trials. So we found potential targets in around 70% of patients enrolled on study. So looking a bit closer at the particular targets, we were able to find more targets with comprehensive genomic testing, acknowledging that even in the lifetime of the study, the standard of care testing was in a process of evolution, with many patients actually getting NGS. But regardless of this, we were able to identify additional actionable genomic alterations in 13% of patients, and that led to a 45% increase in targeted therapy uptake in this group. This is a graphical representation. We don't have time to go through it in detail, but the purple or the fuchsia shading represents patients who were able to go on targeted therapies because of the identification of targets with comprehensive genomic testing. And we show, has been shown elsewhere, that patients have the best outcomes when they are treated with a matched targeted therapy, so best outcome in terms of survival. The aspiration study has completed. However, there are ongoing projects that have arisen from aspiration, including multiple studies listed here on this table, many of which are PhD projects.